Welcome back. Well, we did focus on the unfortunate scenario of Lassa fever, and then both Taraba and Rivers, we understand, are doing something about it. But I think it was on the news as well, wherein they spoke about it. We'll take a look at that, and then we'll go ahead and speak with the Commissioner of Health in Rivers State.
One has to break that contact between the rat and the human population. But that's not very easy because these multi-mammate rats live in and around the houses. They breed very prolifically. In other words, they bring out a large number of offsprings, and they do this very frequently. So they are one efficient way of transferring the virus. Therefore, things we can do include to plug the holes where the rats enter the house, ensure we don't burn the bushes around the houses because that just makes the rats run into the houses. Then some other people use traps, but you have to be careful when you use traps so that when you kill the rat, the fluids from the rats don't contaminate you. Then we also make sure that foods are well cooked and they are kept in containers that are rodent-proof. In other words, when you keep your food, you must make sure they are well covered. That can help you break the contact between rodent excrements and humans. It's also important that when people are infected, they are taken to hospitals where they can be properly treated. Because you will need personal protective equipment, you will need to be isolated. Such patients need to be isolated in special wards. And in fact, the different equipment you use for them, they need to be different from that you use for every other patient. So there must be isolation for such patients. Once you can break rat to human transmission and human to human transmission, then disease just generally takes its path and then dies out naturally. I don't think there's really any need for panic. I think a lot of measures have already been put in place by the Ministry of Health. As I speak to you, we have received more supplies of ribavirin. We have enough personal protective equipment. So it's like we're set to manage the disease. And I don't think there's any need for panic. That doesn't help the situation at all.
All right, let's get the views of Rivers State Commissioner for Health, Dr. Odagme Theophilus. Morning, and thank you for joining us today. Could you then bring us up to speed in terms of the kinds of efforts that you are putting in place, or the state is putting in place, to ensure that no panic and that this is curbed?
Well, can you repeat yourself?
Could you tell us what is the state doing about this outbreak of Lassa fever?
Okay, thank you, Chamberlain. What the state is doing right now is we've, at this point, taken care of the primary center where the patient was managed. We have actually finished the burial of the two bodies. The hospital and the morgue has been decontaminated. The family house of the patient has been decontaminated. The secondary center where the patient had hemodialysis and finally passed on, we finished the process of starting the decontamination. So I'm sure that will take on today. Then yesterday, we received about 2,000 units of ribavirin, and we are expecting arrival of the personal protective equipment from the Federal Ministry of Health. We already have some in the State Ministry of Health. Now, the other thing we have done is the enlightenment has started. We've talked with the primary health care doctors, the doctors in the specialist hospital, and the secondary health care have also been spoken to. Other health workers have been reached, and there's nothing to worry about.
All right, let me jump in.
Enlightenment has been commenced.
Let me ask, I mean, this question is also on the minds of a number of people. They wonder because the last place where Lassa fever was reported in the country, quite a distance to Rivers State, and they wonder, how could Rivers State have possibly contacted this?
We couldn't really get that from the patient that we managed because at the primary center, all efforts to relate it to the case in Taraba could not be established. The family had insisted that the patient never traveled during pregnancy to Taraba State or in the north. So we couldn't really link it to travel. But when the patient was managed and we identified the symptoms, it got to when we established that this is likely to be Lassa fever. The samples we are taking sent to the specialist lab in Lagos, and by the time the result came back, the patient had already died. But because there was suspicion, the patient was not buried, and even the young baby was not buried, awaiting the results of the confirmation.
Is this the first medical case of Lassa fever in Rivers State?
This is not the first.
So in other words, it's possible that there's maybe some other cases or in Rivers yet to be discovered.
No, for this year, we have only 2 confirmed cases. But by this time last year, we had about 2 cases that passed on, and a few other patients were managed and they survived.
If that's the case, then what are we doing to ensure that people are aware of the causes of Lassa fever and are taking precautions?
Now, the Ministry of Health has commenced sensitization at the various local government headquarters, and we intend to move to schools and other public places beginning from today and over the weekend.
Are people listening?
Hello?
If you can hear me, I'm asking how people are accepting the message.
Initially, there was panic, but when they started hearing from government and are convinced that government is active and on top of the situation, I think there is some calm.
Okay.
All right, then, Dr. Theophilus Odagben, thank you for talking to us today.
All right, thank you very much.
So there you go. That's a wrap on the show today for the week, of course. We also thank you for watching and sending in your comments. We'll be back next week. Thank you for watching. I'm Chamberlain Uso.
Well, thank you. I'm Maokwe Ogun.
Many thanks. I'm Sulaiman Alede.